Mm. All right. So I'll introduce myself and get it started, get the party started. I'm Serene Prince. I'm the founder, CEO, holistic psychotherapist of Orchard Blue Counseling Services. I am a licensed clinical social worker, and I have been in private practice for a little over a year. But before that, I was a program director for children with medical special needs. And also, I worked for many years with adults and children with physical and cognitive limitations, as we've reworded it. And so, in my practice now, when working with children, being that like Dr. Toussaint, I am an expert in child and teen therapy, psychotherapy. I thought it was very necessary to bring in a psychologist, an expert, and to discuss the different types of evaluations. I believe some of you are clinicians, and or maybe you've had a child or even adult with special needs or a diagnosis who may or may not have had any form of an evaluation. Dr. Toussaint, I'll briefly introduce you, but I'll let you do the whole gamut. And
Okay.
so I invited Dr. Samara Toussaint, yes, who is a child psychologist and owner of Path2Growth Counseling Services. I met Dr. Toussaint last year
Yeah, at the
at
wellness
a
retreat.
Be More event. I don't know if any Be More folks are here. At a Be More, they are also a private group practice. And I met you there. It was like at a retreat. It was beautiful.
Hmm.
And we stayed connected. And I've been following Dr. Toussaint and her work and all that the great work that she's doing. And I truly feel, even before I had a private practice, that collaboration is key. And that in order to properly serve our communities and our families, that we should collaborate with disciplines, different disciplines, providers and clinicians, so that it's a more comprehensive, if you will, or just like a pillow of clinical and holistic support. So Dr. Toussaint, I'll let you reintroduce yourself.
Well, thank you so much for that intro. And I just want to add that Serene inspired me at this wellness retreat. I have to say that because she said that she was liberated just working in private practice. And I held on to that and I used that to inspire me. So I just wanted to add that because I'm forever grateful to Serene, forever. So as you said, I'm a licensed psychologist, but I'm also a certified school psychologist. And I recently left my school my job of 4 years, yeah. But I've been working in the school for over 10 years. I've played many roles. I love working in education. I love working with kids. I was a teacher's assistant. I've been an intern, and I've been a school psychologist for about, like, I want to say over 7 years now, and it's just been a lovely experience. And I use my background as a school psychologist heavily in my private practice because I'm able to consult with parents on their children's, their IEPs. I'm able to consult with them on services that they maybe or not maybe receiving in school. So it's been a blessing being able to reach more parents in my role as a private practice owner. I also provide trauma-informed therapy sessions, and I'm going to be providing group sessions in the fall. But therapy is one of my many passions. And I also provide psychological evaluations, and in addition to IEP and school consultations.
Nice, thank you. So what I brought Dr. Toussaint here together is to really give us like a one-on-one of the different types of evaluations. Throughout the years, I realized that families did not know, or even
Yeah.
adults did not know, that there were various types of evaluations and who did what. So at times, and Dr. Toussaint, you can join in on this, a child would be diagnosed with ADHD. And I'm going to be transparent as I often am. It's usually a child, a Black or Hispanic child,
Yeah.
that
Yeah.
shares with me that their child is diagnosed with ADHD. And I would ask them, can I get a copy of the psychological evaluation? And they would ask me, what psychological evaluation? And then I would say, well, what about a neuro? Did you meet with a neurologist? And then, they're like, no. And so I would ask them, well, how did your child come to this diagnosis? And they would say, well, the doctor completed something, and then they asked me something, and then they gave me medication.
Yeah.
And that was it. Now, that's not to say that they don't have a diagnosis of ADHD.
Right. Right.
However, that doesn't give you a clear picture of how they experience their world. And then you have the cultural aspect of it also. You have that. You have the misdiagnosis sometimes. And then you also have the age. You have the environment in which the evaluation is being conducted. If it's the appropriate evaluation, what the parent knows, and then you have the culture. And so I have roots, and we both have roots in the Caribbean, and my family is from Antigua and Barbuda, right? Dr. Toussaint, Haiti, yes?
Mm-hmm. Yep.
And so if you can share with the masses about evaluations and how you want to deliver sort of this education to all, and myself as well, because I'll be learning also.
Awesome. I think what you said perfectly happens so often, and it happens to, and I'm really speaking to parents of color on this as well, because as a school psychologist, it was one of my passions to properly educate parents on what evaluations they're receiving, because oftentimes everything is so loosey-goosey. It's so loose. It's like, you should just get your child evaluated, and no one walks the parents through what they're doing. No, and they don't really understand the diagnosis they're getting, and they also don't understand the different types. So I want to walk everyone through this. So the first thing I want to say, as a school psychologist, I want to explain the difference between psychoeducational and psychological evaluations. So psychoeducational evaluations have that educational piece that's very helpful for schools if you want to classify for special education services. So that's something that I did as a school psychologist. However, they differ. They're used interchangeably, but they shouldn't. So psychoeducational evaluations in a school, the purpose of that is not to diagnose. So if a school says, I think, your child is struggling, and we want to refer them to special, we want to further help them or refer them to special ed services, what they're going to do is conduct a psychoeducational evaluation to see what might be happening or what is affecting them from learning in the classroom environment, what's impacting their ability to learn. So that's for one. However, like oftentimes I'll hear parents say, oh, the school diagnosed my child with other health impairment, or they diagnosed my child with emotionally disturbed. A classification is not a diagnosis. So that's very, very important to understand. A classification is something that the Committee of Special Education uses, and there's multiple types of them, but they use them to determine if your child needs services and what types of services they need based on this classification. So you can have a classification of autism, you can have a classification of multiple disabilities, you can have a classification of emotionally disturbed. All these help us, as school psychologists, say, okay, they're eligible for school special education services based on this classification because of the report. Oftentimes they're very similar, because in my private practice, I'm using the same tools that a school's using, right? I'm assessing their cognitive abilities, I'm assessing their academic abilities, but the difference is at the end, the recommendations and the diagnosis. So in my private practice, when I give you a report, it comes with a diagnosis that I think relates to your referral concerns. When a school is doing the evaluation, the school is giving you a classification, but that's not necessarily a diagnosis. So here's the other thing. You can get a psychological evaluation and use it to help your school determine the classification. So I actually get that a lot. A lot of parents want a comprehensive evaluation done outside, and that's fine because it's very helpful. Because in a school, be like, okay, great, there's probably some testing kits that you may use that we don't have at the school, and you can probably do a comprehensive job at evaluating my child. So they'll often use a diagnosis that I would do in my private practice to inform the classification that they need in school.
Okay.
And then, so because I'm a school psychologist, my reports will often also include an achievement report. But the report that you're describing is what oftentimes happens, like when you don't go to someone with a school background or someone who includes the academic piece. So what will happen is your child will go see someone for 15, 20 minutes, and they'll be like, oh, this looks like ADHD, so therefore it's ADHD. And you won't really understand the nuances. You won't really understand, if how their disabilities impacting their academics. So I think that's very important for parents to understand when you're seeking an evaluation outside, that you have someone with a school background, or that you ask them, what's included in this evaluation? Like, what am I going to get from this evaluation? That's a very important question to ask. And how long is an evaluation? I always say if someone says the evaluation it's going to be 30 minutes, you need to leave. You should never evaluate a child for 30 minutes and give them a diagnosis based on 30 minutes of meeting them. I think that's absurd. So I think that for a lot of parents, that's what that ends up happening, because we're in this insurance medical model game where it's just like, let's diagnose, let's treat, and let's move on. And that's actually hurting our students, because they go to school and the school isn't equipped. They're like, okay, so I have this report, now what? There's nothing else explaining what's going on. So a psychoeducational report includes an academic piece that's helpful for identifying strengths and weaknesses in both education and also cognitive abilities. But a psychological report may not include that, and it may just include a diagnosis or a cognitive assessment. I know I said a lot, so I'll let you ask me a question based off that.
Right. Sorry, I was looking away at, multitasking here, trying to keep some Facebook up. But I hope everyone knows that we welcome questions and clarifications. And so, Dr. Toussaint, in my experience, when I worked with children that had special medical needs or cognitive limitations, the psychoeducational evaluation was difficult to get. Right? So you have a child who may have some limitations in their speech, in how in their motor skills, or just that they were in their developmental stage, they were not meeting the marks in terms of how they should be functioning.
Right.
And so people out there, you may have heard of, like Dr. Toussaint mentioned, IEP, but children receiving early intervention.
Right.
And then as they turn 3, then it's the CPSE evaluation that usually includes the psychoeducational evaluation. And then that's supposed to be done when they are in CSE, usually after 3 years. Now, the thing is, this document evaluation tends to follow the child. Am I correct?
Right. So, go ahead.
Now, yes.
So once an evaluation is completed, what will happen in a school is that we wait 3 years to reevaluate them, what's known as a triennial. And that's to see if, after 3 years, are they still eligible for special education services? So that's why it's really important to evaluate them every 3 years. Okay. However, sometimes parents between those 3 years will say, oh, I want some answers now. That's fine, but you don't want to over-test your child. I would say, like, if you have a report and it's within a year, and I would say that it's still valid. You don't have to kind of rush out to kind of get report after report after report. So your school, if you're eligible for special education services, your school will automatically do a 3-year assessment, a psychoeducation evaluation to determine if special needs to determine if special education services are still needed.
Okay. So now let's say we have a child who is, I don't know, 7.
Mm-hmm.
And the parent is getting calls from the school. The child is not sitting down. They're not listening. Um, they are speaking out of terms. And the school or teachers, and sorry, teachers, I'm not trying to give you a bad rap.
Yeah.
They
We love our
are,
teachers.
yes, we do, right? And they may recommend that the child get an evaluation or some sort, or get medication. I've heard that, the quick fix. And so they may say, oh, the child seems like they have ADHD. What type of evaluation would you recommend
So I just want
to
to
rule
say,
out? Mhm.
sorry, what bothers me, and I just want to say that if you're a parent and if any teacher ever says, "Hey, your child needs medication," or I think you need to tell them off, that you should not, as if you're not a medical professional, if you have not been trained in any psychoeducation on a medication and side effects, you do not have the right to tell any parent that they should that their child needs to be medicated. That's number one. Number two is, if you have concerns, right? If you're an educator and you have concerns, it's okay to bring them up and say, I do have concerns that they're not sitting down. I do have concerns about all these things. You know, they're talking out of turn. Let's have a meeting and talk about this. Before there, and this is why I do a consultation, before I consult with anyone, I want to know, and this is what every school should do, their due diligence. There should be multiple steps before an evaluation happens. Multiple steps. That's what people like to jump straight to an evaluation, and that's not okay. Especially if a child is having difficulties, there should be multiple meetings in a school where we're assessing, all right, let's assess whether this is going to work. Let's do multiple interventions before we decide to do a psychological intervention, because it's very invasive. And I
Mm-hmm.
feel like it should be a sacred process that should have multiple steps to it. Oftentimes, what will happen, especially with kids of color, is that teachers are trying to rush and immediately say they need to be evaluated, they need to be assessed. And that's not
Mm-hmm.
okay. I always say, okay, well, what was done before? What interventions were done to hold their attention? What interventions or multiple, is a teacher trying new ways of, or do they have engaging materials that they can use? That
Mm-hmm.
should happen first. If and
Mm-hmm.
when the child is not responding to those interventions that are put in place, then we can talk about evaluations. Then it's
Mm-hmm.
appropriate to say, okay, we have all these systems set in place, they're not working. Now it's time to get evaluated. Depending on what
Mm-hmm.
it is, like let's say it is for an intention, I might say, okay, we could do a psychological evaluation to assess and examine the data. If it's something more severe, then I would recommend, like if it's something speech related, if it's something, related to their body, I might say, okay, maybe a physical therapy or occupational therapy evaluation, but I wouldn't straight jump to a psychological evaluation first. I would first do a good assessment as to why they are struggling and why they might be talking out of turn. Maybe they can have a behavior intervention plan before we go psychological evaluation. So I think that's where sometimes parents struggle, because they'll take the teacher's advice and then they'll get evaluated and they don't know what to do with it. And they're just saying,
Mm-hmm.
okay, now my son has a diagnosis of ADHD. They're classified as emotionally disturbed. Now what?
Yeah. And also for the parents, it can be daunting because not all, but many parents feel it's a reflection on them and their
Right.
parenting and something they did
Exactly.
wrong, or when maybe they were pregnant, I've heard parents like, I had a glass of wine. I'm like,
I
that
know.
is,
They start to blame themselves. That's why I said this
unless
is
it
such
was
a delicate
excessive, so,
process.
I'm like, you know, and they start to blame themselves and a lot of guilt.
Mm-hmm.
And some teachers may feel that, or educators may feel that the parent is not working with them. And that's a whole nother segment that we can do
Yeah,
about bringing the parent and doing our best, as many teachers do. And I just want to reiterate that this is not bashing the teachers. This is
I
really based
agree.
on
I love
our
teachers.
our experience and what the parents have disclosed to us, not only with teachers, but also pediatricians.
Mm-hmm.
And yeah, so parents also may say, well, they had an evaluation.
Yeah, I
And
was
I would
gonna
ask
get
them,
there.
well, what did you have? They're like, oh, the one that gave the medication. I'm like, that's not a psychological evaluation. And we want a thorough. Tell us about that.
So that's another thing is that they go for what they're actually going for the psychiatric evaluation, which is done by a psychiatrist. I want to say two things about that. One, like let's say you did your due diligence to school, we have a report, a psychological report, and the child isn't responding to the recommendations in that report. So we want to escalate it up to another level and say, you know what, we might consider medication. That's when you refer out and say, okay, let's get a psychiatric eval done by a child psychiatrist, by a child and adolescent psychiatrist. But here's the other thing. If your child is being evaluated for 15 minutes, that's not okay. Their good child and adolescent psychiatrists will take at least 45 minutes to an hour to explain to you to go through all the side effects of the medication, the different types of medications. If you just go and get a psychiatric evaluation and they say, okay, take Concerta, that's not okay. I've met phenomenal child and adolescent psychiatrists who will literally walk you through different types of, let's say it's ADHD, stimulants and non-stimulants, and go over the side effects. That is an appropriate psychiatric evaluation because you're being informed. If you're putting something in your child's body, you want to know every single thing, and you want to be able to ask that psychiatrist question because that's your treating provider. That's someone who's going to be with your child and check in every 3 months or so. So you really want to make sure you have a good relationship with your psychiatrist and that during the evaluation, you can ask them questions and say, I'm worried about these side effects. I'm worried. I heard A, B, and C about Adderall. Tell me more about that. You really want a psychiatrist who's going to do their due diligence and give you a good report, good feedback, and good psychoeducation on a medication that's going into your child's body.
Yeah, I appreciate you doing that. And some parents are confused that the psychologist is going to prescribe medication.
Yeah, I get
and
that
that is
a lot.
automatic.
Yeah.
But before I go into that, when I used to work in a clinic, there are some clinics, don't go check in my LinkedIn now, but you can. There are many clinics, and Dr. Toussaint, I'm sure you can attest to this, that there is a policy that they institute that the client, when they come in, that they have to have a psychiatric consult, right? And so sometimes, as a clinician, well, most times as a clinician, unless there's evidence where the client's coming in and they're already on medication, or that perhaps a consult will be helpful, the idea of introducing medication to someone within 30 days of seeking mental health is traumatic to me.
I agree,
As a clinician,
100%.
and I couldn't do it anymore. And it came to the point where I probably had burnt myself out, where I would collaborate with the psychiatrist with the client's consent to join them in on the psychiatric consult. Because I wanted them to understand that this wasn't a thing where medication was being pushed onto them or encouraged if it wasn't necessary, but just more I was collaborating and providing that necessary support that I felt that the client needed. And so I just wanted to share that because it turns off the community and community of Black and Brown people.
I agree.
When you have certain insurances that are not accepted by many private practices, and these large clinics, mental health clinics, accept it, and they have these policies where you're required to see a psychiatrist within 30 days. Anyone culturally who is opposed or frightened about the idea of mental health, you offer that to them, how inclined or how engaged would they be in mental health if they feel that the psychiatrist down the hall, they may very well be referred to them
Right.
again. Or the fact that maybe it's a consideration and no one's letting them know,
Right.
you know.
I agree that, especially for communities of color, just to walk into a clinic and just be like, oh, you have to have a psychiatric consult within 30 days is ridiculous. Like I said
Mhm.
before, um, my process is that we first identify and look at the data and then decide whether or not there's a diagnosis or not. That's the other issue that I want to get to real quickly. It goes against our training as scientists
Mhm.
to just go in saying it must be this. If you're saying a child needs medication, then you're already going in with a diagnosis. Like oftentimes parents will spend 30 minutes on the phone for a consultation and then they'll say, well, what do you think it is, Dr. T? And I'm just like, I don't know anything. I don't know anything until I look at the data, I assess your child, and I go through everything with a fine tooth comb. So
Mhm.
I'm going in, your hypothesis is supposed to be there is nothing really wrong until I see something wrong,
Mhm.
until the data suggests there is. So for some people to just say, well, automatically you're coming in for something, it must be A, B, and C, it must be ADHD, it must be autism. So therefore, you might as well just medicate them anyways. Absolutely incorrect. I always say, look, take my paper, take my report, take my recommendations. I want you to try them. If in 3 months they're still struggling academically, they're still struggling at home, they're still struggling in the community, come back and we'll talk about how we can either improve the recommendations and the feedback I gave you, or we can then consider a psychiatric consult. I always use 3 months. 3 months is my golden rule because one, you want to give 30 days for things to settle in. Then you want to assess it for another 60 days. And if 90 days is not getting better, then. And I often use that because then parents will come back to me after 90 days and be like, I tried everything that you said. I did parent training. I did all these things and it worked. So then there is no need for medication. But if you're automatically
Mhm.
going on medication, then you're already saying something is wrong. And it shouldn't be that way at all. It should just be,
Mhm.
let's assess the data to see whether or not we have a diagnosis. And I always tell
Mhm.
people, if someone gives you a diagnosis within 30 minutes, you need to run. Ask for your money back and say, you saw my child for 30 minutes.
Mhm.
I have to go to someone
Totally
else.
agree. Totally agree. Yes. Um, what came to mind? Oh, someone asked a question
Oh,
about
yes, they did.
insurance paying for psychoeducation evaluations. I'm just going to
Oh.
answer no. But Dr. T, I'll let you.
Oh gosh. Listen. These insurance companies, and you would swear it's like it's pulling teeth. It's so bad, especially when it comes to, I would say the worst is autism evaluations. They will not cover it. Some will not cover it unless you're using a specific type of intervention, which is absolutely ridiculous. And some will cover a portion of it, which is what I always explain thoroughly when my parents come in. I'm always just like, a lot of times your insurance company may not cover this. There's almost a guarantee. If they cover it, dance for joy, but most of the time they do not. And they especially will
Mhm.
not cover the academic piece that I was saying. They're really
Mhm.
into kind of just saying evaluating a child for one session and then giving a diagnosis, which goes against, again, our training. So I try to
Mhm.
say, like, look, well, let's work something out. But most of the time, insurance companies will not cover a full comprehensive psychoeducational evaluation. And if they do, they're really covering part of it and not all of it. Some of it you may have to pay out of pocket. It really depends on your insurance plan, but for the most part, they don't.
Yeah, they don't, unfortunately. Um, but that was an important question because I
Hmm.
can imagine that the wait time is also long.
Yeah.
Even when insurances pay for a psychological evaluation, the wait time is long for both children and adults.
Yes. Yes.
Um, Dr. Toussaint, what I also wanted to touch on, I don't know if you did, but neuropsychological evaluations and how do they play a part?
So you brought up a great point too that I want to mention, that you can get evaluated at any age, and you can also get evaluated. You can have a psychological and psychoeducational evaluation at any age as well. The neuropsychological evaluations are a little bit more in depth. And you're really looking at the brain and understanding how certain aspects of the brain may have been affected by certain things. Like, let's say you've had a traumatic brain injury, and you're suffering from some memory issues, you're having attention difficulties. That's when a neuropsychological evaluation would be very helpful, because they do specific tests to identify either deficits or skills lost within your executive functioning, which is like planning, memory, attention, and all those other things. So it's really just an in-depth look at the brain and what issues may be impacting your brain functions. So it could be helpful in identifying learning disability. It could also be helpful in identifying and looking at a more in-depth view of ADHD, or, like I said, memory loss, Parkinson's disease, traumatic brain injury, neurological trauma.
And I know that insurance persons usually ask about payment, right? Payment is a huge thing, because they are costly. And so with neuropsychological evaluations, in my experience, that most insurances do not cover that, or most neuropsychologists are private pay.
That's more often the case.
And that's more often the case, unless they have like slots where, they got a grant. That's not to lose all hope, because I'm speaking from New York City. That may be different in another state where you are. However, usually it's not through insurance, but it can be helpful. But psychological evaluations are helpful too. And I don't want to further complex it. The purpose of this is to really inform, persons, whether you're as a child or an adult. And I feel I have some knowledge, but I feel that it's still limited, and I can always learn much more. So in a psychological evaluation, I may ask, well, what type of scale would you use, right? And the back in the days, Vineland, adaptive behavioral scale was oftentimes used, but then you have the WESC. Am I saying that right? You have different.
The WISC, you mean? Oh, the WISC, right?
Yeah. You have different, and maybe you can share maybe one or two that are used, and what does that mean? Because I know parents are sitting, or a person sitting in the consultations, and they're like,
I know.
I mean, and even as even as someone who's a clinician, if I'm going to a doctor's, I said, talk to me in layman's terms. Talk to me like I don't know anything. And I need you to break it down for me, because I'm overwhelmed and I got high blood pressure. Like, don't give me all of that. Right. So, yeah.
So at its core, your psychological evaluation is really just testing your cognitive abilities, right? And testing. So I'll walk you through the different components that I do. So first, I'll assess your cognitive abilities using, like you said, a Wechsler, which is a WISC, or a WJ, Woodcock-Johnson test. So those are like the big ones right there that we all use. You can use a Stanford Binet. There's different types of tests that we use, but I often tell parents that, what I'm doing is I'm assessing their memory, I'm assessing their attention.
I'll be right back. I'm just removing, I think one of these technologies is cutting you up. Continue.
Oh, really? Okay.
But I can hear you.
Oh, you can hear me? Okay. So I'm assessing different aspects of their cognition. And then the second part is assessing their achievement, their academic skills. So you might use a Wechsler. There's an achievement battery for that, or the Woodcock-Johnson achievement test. There's a lot of different achievement tests that we use, and you really want someone who's familiar with all different kinds, because different kinds serve different purposes and might be helpful in engaging different types of students. So that's the academic piece. So there's multiple batteries that we're all trained in. We all have our preferences, but sometimes we need to break out of the preferences and do something that fits the child's needs. Another portion of the psychological evaluation that's helpful is a social emotional piece, because if you're coming in and saying they have behaviors, they have all these things, I need to know why they're not focusing in school, or why they're behaving this way, or why they're so impulsive. the social emotional piece is helpful because we have multiple tests that kind of test for that assess personality, like the BASC-3. What else do we have? We have the Connors, which is really widely used to assess if ADHD. So that's what we use to back up a diagnosis of ADHD, autism, learning disability, etc. Is that social emotional piece. Whatever your referral concerns are, that's what I'm going to use to determine what tests I'm going to give you or give to your teacher or give to someone in your community so that they can give me further data and insight into what you're struggling with. So there should be 3 parts. Oh, someone said that they're not hearing anything. Can anyone hear me?
You're not hearing anything?
Can you hear
Please
me,
put a
Serene?
thumbs up, anyone, if you can hear.
Oh, okay. So someone said that
Okay,
they
so
can't hear.
refresh.
Yeah,
Team
refresh.
organizers. Okay,
So
yes, continue.
comprehensive evaluation, in my opinion, should have the cognitive piece that assesses your cognitive abilities, should have the achievement piece that assesses the academic piece abilities, especially if you're coming in for a learning disability referral, and also the social emotional piece where we can assess behavior. So those are the 3 parts that really should, and then also the diagnosis and recommendations.
And I just want to share with people too that some of, when a child has an evaluation, some great stuff comes out of it.
Yeah, I
And
agree.
their intellect, the intellectual,
Mm-hmm.
finding out that they were misdiagnosed.
Oh,
I
God.
told you so. But
Well, I just want to add that in my practice especially, what I'm finding is that Black boys who have autism are being misdiagnosed with ADHD.
yes,
That
I was.
is,
Yes.
and it's backed by research because they found that Black boys are 3 times more likely to be misdiagnosed with ADHD or behavioral issues as opposed to autism, which delays the services that they need. It's almost like a niche that I'm developing because I'm very, very passionate about Black children being appropriately diagnosed. A lot of times people are scared of diagnosis, but I say diagnosis can set you free if it's the right one. Because once you know exactly what something is and you can name it, then you can treat it. But if you're misdiagnosed, that's the worst part. I say it to parents all the time. If you have a misdiagnosis, that could lead to the wrong medications, that could lead to the wrong interventions at school, and you could be doing something that doesn't help your child at home. And then you're further frustrated and it further delays, and I think contributes to the school to prison pipeline, especially for our Black boys. And they deserve better. They deserve better. It really bugs me. I think I want to say last year I had 3 reports that I had to redo for parents to classify their children with autism so that they can get proper services in school. And I know that there's going to be a lot more.
I can't tell you how many times that has happened. If it happened once, it's more than too much.
It's a lot. Yeah.
And
oh my
when
God.
the parent got the diagnosis, she nearly dropped to her knees. And to find out not only, so some people are like, well, why would it be good that a child is diagnosed with ASD, autism spectrum disorder? I mean, I love them, their level of intellect, specialty and memorization and artistry, that it is impeccable, and it sets them and puts them in the appropriate class.
Yeah,
and it allows them to really be an environment, because the next step is now finding the right classroom, right, or school. But like Dr. Toussaint, it really does set you free. And then the medication, sometimes there's no medication or there's a change in the medication. I mean, and you see such a change in this child and how confident that they are. And if you label someone or misdiagnose them with ADHD, learning disability, and you put them in an environment or a classroom such as that, right? And I'll add something to that real quick. they're going to behave as such eventually, because you're expecting them to, even when they're showing you their level of intellect.
Exactly.
And I want to turn this into something else, but you know, mental health, and I said this in another live or wherever I was, that mental health has not been kind to Black and brown people, specifically Black people. And we are working effortlessly. I mean, Dr. Toussaint looks beautiful, but trust me, she is doing the work. Okay? You see my bun? Yeah. My bun represents last week. Had a good weekend, but we are putting in the work. And it's that I'm not humble, but I want you to say that there's more work that goes into it. Just not having a child sit down in front of us, that when a child comes to us for therapy, that we are really taking the opportunity to learn about the child. Dr. Toussaint, I know you wanted to talk about that, talk about culture, ethnicity, when a person is doing evaluation. I've spoken on a live one time about cultural competency. I'd like you to share we're already on that, so you know. I mean, what time is it? Because I got all night.
I know, me too. In my practice, I always say it's important to take a generational approach, like identifying, like I don't want to ever just say, you know, you're behavioral and this is that. Like I'm not just treating the child, I'm also treating the family. I also like to assess, okay, so what are the child's coping skills? Who's modeling what for them at home? Like, you know, at what age did they start to identify feelings, and at what age were they practicing or what age were they practicing coping skills? What are coping skills? Like I go through an in-depth review for parents, and I try to tell them, I was just like, look, some of these things that may be happening in the classroom can just be rectified with just changing things at home or just changing your approach to how the schooling system. So that's one piece that I think is important to include culture. The other piece is, and I just was speaking, I did a training on this, is that some people think race automatically equals culture. And that's not the case. If you're going to include someone's culture, you're including that person's behavior, their values, how they view mental health. I mean, you're from Antigua, I'm from Haiti. We have different cultures. We have different cultural backgrounds. We're still considered Black, but just with the two of us, there's differences between us. So just imagine a whole school of children that are majority Black and brown. You're going to have different 100 sets of different cultures that are important to look at and include in your report. Like, what are their views on mental health? What are their views on education? All these things are very, very important because they could be impacting, exactly, we're all raised differently. They could be impacting that child's mental health, and they could be impacting the way that that child interacts with the world, especially in the school. So I think it's very important that a lot of practitioners really seek that culturally competent training, especially in assessing and evaluating, and start confronting their bias. Why is it that Black boys are more likely to be diagnosed with ADHD and not autism? Why aren't they given that? Why, or not even oppositional defiant disorder? Why are they giving those two diagnoses first before autism, when sometimes it's very clear cut? So it's very disappointing to see that statistic, and it's very disappointing that I have to kind of go in and kind of rectify it, because it really makes all the difference. Because like I said, once I have a report that says autism, you can go to the school, get reclassified as having autism, and then get services, get access to parent training, get access to a smaller class size, get access to the right interventions in the school. Oh, maybe you need a token board, maybe you need visuals. You're not really getting that if you're just saying that Black boy is oppositional.
Yeah, I can talk about that.
I know, we all can for days.
And so you also have, right, when it comes to ethnicity, persons who are white, but their ethnicity is Hispanic. And that's very important too, because persons will assume, because this person has checked off the race white, that they identify and can relate, or that they don't have to go dig deeper because they are white. No, someone who has a race of white with the ethnicity of Hispanic will likely, I'm not saying always, but will likely identify well and relate to someone who's of Dominican, from the Dominican Republic. You have the language, you have foods, you have, just culture. And so that's very important to recognize. And I think we both make that, not I think, we both make that effort when we are interacting with our
Yeah,
families,
right.
and doing our assessments and carefully doing so. Everyone, I hope if you have any questions, we definitely want you to ask them. There is no right or wrong question. It's how we all learn. I'm learning as well. And so I think a lot of times, even adults, right? So I've had adults who would benefit. And can you tell us if and how a psychological evaluation looks different for children versus adults?
I don't necessarily know if it looks different. The recommendations might be more geared towards, like, instead of the classroom, might be geared to what you could do at work or what you do at home. I think
Mhm.
for adults, sometimes it's because no one ever noticed when they were children. I've been doing a lot of evaluations for kids who were kind of slid under
Yes.
the radar. So that's also problematic, that they've had to kind of live with a diagnosis or underlying diagnosis for so long. I think for adults, what a lot of times the majority will come in, especially if they're coming before college, where it's just like, I
Mhm.
think that something is wrong, or during college, or even some people who are just like over, for the year over 40 years old, they're just like, I know something is wrong, someone missed it, it's severely impacting how I'm interacting and doing my work project or completing my work projects on time. So I think it's very important. If you think that something is wrong, you still can get evaluated. Oftentimes adults are just like, maybe it's too late. It's never too late. Oftentimes those assessments that we're talking about that can be used to test children and adults, they go up to age 90. So at any point you want an evaluation done by a psychologist, you should absolutely do so, especially if you feel like it's impacting your ability to function at work.
I never thought of that. It goes up to age 90?
Yes, some of them, yep. All right, I forgot the age. I'm pretty sure I'm blanking if someone knows it, but I think the WJ definitely goes up to that age range.
What's the WJ?
The Woodcock Johnson.
Ah, and is that a scale that you
No,
use
that's a
for?
testing battery for like I said, for testing your cognitive abilities. And they also have an achievement test. Yeah, a lot of times you can get evaluated, especially at any age. If you feel like you are struggling, please, please seek help. Don't feel like, oh, that's for kids. It's also for adults. It's also to help you function properly and just make you aware of what's going on.
Right. I also to stay on top of it with regards to psychological evaluation and age. So how do I word this? So there are times where I may have had concerns that the parent will miss the opportunity to participate in the evaluation as the nurse practitioner. Well, I'm gonna have to say your ad because this is my cousin, by the way, my god sister,
Mm.
sexy family nurse practitioner mentioned about parents being the advocate and participating. Um, that so the age where a child can engage with a provider, I believe is 16 in New York City, without the parents' presence. They can say, I don't want them to participate. And so sometimes they may say yes or no. And if I believe an evaluation is due, they may have had an evaluation, but they hadn't had one. I would, and you can tell me if I'm right or wrong, I would encourage them to try to get it done before they're 16 if I see that there's a lot of parent-child conflict. I said, because once they've had that psychological evaluation, and if they decide they don't want you in the interview process because there's already existing conflict, you don't know if they're offering the information that the psychologist needs in order to conduct a full evaluation. and I'm fine with you telling me if I'm right or wrong, but I am a clinical social worker and I am a social worker.
Yeah, you know
And
policy.
so, and the reason why, because I'm looking at this person at 25, substance use, they have this evaluation based on what they reported. They didn't want their parent involved. And this is what they're going to use possibly to obtain services or accommodations or whatever the case may be. And I think it's always important that the more the psychologist knows about the different dynamics, hopefully the better that they can evaluate when it comes to a teenager. Drop it on me.
Well, I hear what you're saying 100%. I definitely think that parents should be involved at every step of the way, especially because you always want two people in the room hearing the same information because you never know who can miss out on what. The other part
Mhm.
of it is, though, what I have seen, unfortunately, is that sometimes for some teens, they find themselves in a position having to advocate for themselves because their parents aren't. So there's a very real reality that some teens are just like, or a parent might be scared of a diagnosis, a parent might be scared and they don't want to be labeled, they don't want to bring shame on their
Mhm.
family. And
Mhm.
when their teen might be saying, I am struggling, I need help, I'm going to seek this out, I can't wait for you, I need to do this, especially for college. I could see that. I could see how it might be warranted. But I think then it's up to the psychologist and anyone that's evaluating said child to say, you know what, I understand what your concerns are, but is there someone in your life, some other adult in your life that's willing to help you on this journey and
Right.
maybe and go over the recommendations with you? I think that would be really appropriate because I feel
Mhm.
like I understand what our team may be coming from, not wanting to have someone, but there's got to be some caregiver in your life that we can kind of collaborate on because I do ask for feedback from parents. I do ask for feedback from teachers or anyone else in their life. So it would be very helpful to have someone else's input there to really make a diagnosis or to really just inform my recommendation plan.
Okay. Yes, I could definitely see that where it could be sabotaged or not offering the best information when they're not, the person that's supposed to care for them is not able to care for them. Yeah. Is there anything else you wanted to provide us, educate us on, inform us about when it comes to psychologists, right? Because
Mm-hmm.
we are both owners of a private practice. And so someone may say, well, why would I go to you? And why would I go to you? You both are saying that you provide therapy. And I think, not I think, there were many years because, I'm not as young as I look,
Mm-hmm.
but there were many years where there were like social work and psychology were above heads. And sometimes even now, right? And some of the modalities are different. So people will be confused like the psychologist is my therapist, but the clinical social worker is my therapist. What do you want to inform the masses about psychologists and their delivery that you think will be helpful in informing them? Not to say that they have to choose one or the other, but I think the more informed persons are, the better they have an understanding. Because if they see that you're a psychologist and they're like, well, is she going to like evaluate me? What is she going to do? Yeah. So what do you think is important for them to know?
I think it's important for people to know that even though that our title is psychologist, at the end of the day, we're also your mental health advocate. And I think I think that you and also you can do that. I can do that. Our training
Mhm.
is one, yes, part of our training is to evaluate. But like I said, part of our training is also to go into an evaluation using data to inform our decisions. So that was a strong piece of my training was
Mhm.
identifying go out.
Now you're back.
Oh, no, I'm not. So I think that that's a huge part of our training that might be different from social workers or mental health
Mhm.
counselors is that we did spend extra amount of time in evaluation and assessment. So that's something I would say that we're strong in, not saying that we're stronger than other people, but just saying that's an area that might be helpful especially if you want more information on how your mental health disorder may be impacting areas of your life.
Thank you for that. Yeah.
Yeah.
And in the same with therapists, we conduct what we call comprehensive psychosocial assessments and assessments,
Right.
and they differ. And so I know people, and I don't like to run away from questions, people will ask, well, can I use my insurance? The answer is no. So a comprehensive psychosocial assessment is very in depth. And we're looking at we're not necessarily using the same scales, but we use some scales like generalized anxiety disorder.
Yeah.
We're using the PHQ-9.
Right.
We're looking at PTSD, life events. We're looking at all of that in order to offer a diagnosis. And so a licensed clinical social worker also offers a diagnosis, but I stay in my lane. And if I feel that I don't have enough data also, and when I'm doing my assessment, I may likely refer the client to see a psychologist to rule that out. I do not diagnose ADHD or ADD. I don't know if any licensed clinical social workers do, but I prefer that they see someone who's trained and knowledgeable and smart who can do that and rule that out if necessary, and we continue to work
I think that's
together.
great.
So I just want to raise that I respect psychologists and you, Dr. Toussaint, and
I
all that you
respect you and
guys
social
do.
workers too. You guys are it's better when we all collaborate and we work together because we all
Yes.
have strengths and we all have areas where we can learn from each other, right? There are a lot of areas that I can learn, especially because I feel like social workers are so well trained in policy that, that's an area that we're not necessarily trained as much in, but I feel like if we all collaborate and work together, then that's just the best way that we can address all the racial inequities in assessment and evaluation and treatment. Right?
Yes. And as Dr. Toussaint mentioned, that what about your group again? Tell them about your group.
Oh, so we will be offering group therapy starting in the fall. Over the summer, I'm going to be, and also I will be offering psychoeducational assessments in the fall as well, because I imagine that there's going to be a lot of people who want a lot of answers. So starting September, we're going to have groups, and starting to September, I'm taking a little hiatus because, it's been a lot. There's a lot going on, and I currently have a wait list for a psychological evaluation. So if you are interested, just know that I'm picking it up back again in September. So I look forward to just informing and helping people and advocating for people.
Yes. And just as Dr. Toussaint's practice, Orchard Blue Counseling is also offering groups. It's called a Teen Wellness Community. And it's for teens ages 12 to 17, broken up in two. So you have ages 12 to 14 and ages 15 to 17. And the group runs every other week. And what's included are 8 individual sessions in conjunction with 6 group sessions.
Nice.
Okay. And we both, and Dr. Toussaint, you can add on, we both recognize that there is going to be a need of support and community. A group can really offer that in a
reopen
way. Schools reopening is going to look different. Children will be required to come in person.
Right.
Everyone is readjusting. They thought they had to we struggled last year. A lot of people got used to remote learning, but then also what happened is that their development, and I want you to touch base on that because I talk a lot about that, about how the development, arrested development, right, with the pandemic and the important stages of that were happening. So if you have a child that, turning 13 is huge, right? So I was like, I'm a teenager, and then you're in a pandemic, you're like, how does the 12-year-old develop into being a 13-year-old? Some people had 2 birthdays. So can you imagine that? Yeah. So I don't know if there's anything you want to add on about that.
First, I want to say 2 things. I just want to say, give your children some grace because this is something that we've never experienced before. I mean, for them, this is new. Like we even as adults, we can't say, "Oh, I've been in your shoes," because back in the day, there was a pandemic when I was growing up. There wasn't.
Right.
They're learning, we're learning. Give them some grace. It's a lot. The best we can do is provide them with some emotional support. I can say that I want, just like we're worried about their development, these kids were resilient. I mean, I've seen kids learn so much more about
Mhm.
computers. They were logging on, they were learning remotely. They really got it together. A lot of our kids, like we have to acknowledge that
Yes.
they were, regardless of what happened, these kids logged on. I mean, I had sessions in as a school psychologist with a 5-year-old on a computer. Who would have thought? And the way that they were able to just say, "Oh, okay, school's on a computer now. Okay, no problem." I think, well, not all kids,
Mhm.
but I'm just saying, like, we have to recognize that that is extremely resilient and celebrate them for that, because it was a huge mind
Mhm.
shift in the middle of the night. We asked them all to
Mhm.
log on. Some were even logging on their parents' iPhones. I mean, come
Oh.
on. They really got a lot of our kids. We got to give them more credit because we couldn't really
Yes.
guide them. We couldn't really say, yeah, when
Mhm.
I was your age, this is what happened.
Mhm.
They learned, they watched us, they watched their teachers. Shout out to the teachers as well. We all got it together. And another thing that I want to
Mhm.
say is when they return, I don't want you guys to rush to get them evaluated. Give your kids time to adjust. Like give them
Exactly.
give them time
Give them a minute.
give them a minute to just settle in, reunite. It's gonna be anxiety provoking because some kids have kind of preferred being in person because it's school can be anxiety provoking for some kids, especially our Black students, right?
Mhm.
But I feel like just give our kids a moment to breathe. It's okay. We don't have to rush to evaluate them. Yes, they might be behind, but they're gonna catch up. They showed how resilient they
Mhm.
can be over the pandemic, and they're just learning just
Mhm.
as much as we are.
Mhm. Yeah, totally agree. And that's for children everywhere in the
Yeah,
Caribbean, like
yeah,
in Antigua and Barbuda. These children, they were on these phones doing the
yeah,
most. Like
yeah.
Google Meets act up, and I probably had gained 5 gray hairs. Like I, like,
These kids were
and
like,
they
they
are
were doing
learning new
jumping jacks outside
information.
on the iPhone, like, yeah, we're in gym. Like that's what I'm just like,
Yeah,
I can't
right.
imagine. I was telling my husband the other day, I was like, I cannot imagine this happening when we were in school. We didn't have computers the way we did, laptops or cell phones. So these kids just really just said, you know what, we're just gonna have to adapt to the times. I see my teacher online, I have to do it. So we have to give them some type of credit for getting through
Yeah,
that.
yeah, yeah. Dr. Toussaint, thank you so
Thank
much.
you. This was awesome.
Yes, I hope everyone in got something from it or can share. I'll be posting the live um, on my Instagram page and Facebook so you can share with others. And I thank you and hope that we can do this again,
Yeah, yeah.
whether it's psychological evaluations or just coming together, because we are better together.
Agreed. Agreed.
Everyone, have a great night and thank you.
Thank you,
Mhm.
everybody. Have a good night.
Okay.